We start this half hour with a new study suggesting weight loss drugs like Ozempic and Wegovy may actually help lower the risk of certain cancers. So joining us here to talk about it is ABC News medical correspondent and our friend, Dr. Darien Sutton. Welcome. So this obviously, Wegovy, Ozempic, all of these, we've had our eyes on these for a while now. Does this study surprise you? Tell us about it.
You know, surprising, I would say no, it doesn't surprise me because we continue to see more and more results from studies like this. So just to get into this study, a large peer-reviewed study published in JAMA, the Journal of American Medical Association, following more than 1.5 million people over 15 years living with diabetes and obesity, some of whom were taking these GLP-1 medications like Ozempic, for example. And they found at the end of that 15-year period that those patients who used these GLP-1 medications like Ozempic had a significantly reduced risk of 10 out of the 13 cancers associated with obesity. We're talking about things like pancreatic cancer, uterine cancer, and in some cases, more than a 50% reduction in the risk of colorectal cancer.
So tell us about the relationship between obesity and the risk of cancer, because I know you're following that.
You know, that's a really important discussion. And Gio, I would say it's complicated and it's not completely understood, but there are some main theories that help us to understand why patients with obesity have an increased risk of cancer. When you look at the studies, things like hormone disruptions, factors like growth factors and insulin can increase the risk of cancer cells. Chronic inflammation, even dysregulation of the immune system. But this medications like Ozempic, Wegovy, they simulate mimic a gut hormone. And the question is, how does that apply into this equation? And that's why more data needs to be expanded.
So in general, beyond the medications that we're talking about here, what are some other ways that people can improve their lifestyles and reduce their overall cancer risk?
Well, you know, we'll continue to do more studies like this to understand the answers to the questions that we asked today. But in terms of reducing the risk, there are some things we all can do in our daily days. Number one, making sure that we're getting screened. That's the most important thing. Screening, not only is preventative, but you can catch cancers early. And then we know that prioritizing sleep, having daily exercise, even if you're not losing weight, and making sure that you're focusing on a healthy diet, avoiding saturated fats, avoiding processed foods. These are methods that are tried and true in terms of reducing the risk of cancer.
The prioritizing sleep part, that's the one.
I know.
That's the one that always hurts, Dr.
Every time
Sutton.
I say it to the three of you,
it's like you looked right at me with that.
I know. I got to figure out something else to talk to you about in terms of reducing the risk.
We'll get there eventually. Thank you, doctor, as always. We appreciate it.